Hey guys, Tony Maritato here. So let's talk about the best sitting position after a total knee replacement. And what we're going to do is we're going to break it up into different recovery phases. So phase one recovery is usually the first 48 hours. And what I typically tell my clients is don't stress out. You're going through enough. It's frustrating. It's hard. Sit in any position that's comfortable for you. Most of my clients, that's going to be sitting in a recliner where they're reclined back, the leg is elevated, there's support throughout the entire leg. I just recorded and shared a video where I talk about not placing a pillow behind the back of the knee if you're having challenges gaining knee extension. But in the first 48 hours, you're really just trying to recover from the trauma of the surgery. I would tell you, get some rest, try to relax, don't worry too much. As long as you're on your feet, as long as you're moving around, working with a physical therapist, you're probably going to do great regardless of what position you're sitting in. After that acute phase, after phase one, we get into day number 3 through day number 14. Day number 3 is usually the most challenging day. First things first, it's when the anesthesia is completely worn off and is out of your system. You're probably doing more, you're more active, you're feeling the real soreness of the surgery kick in. But during that time, day 3 to day 14, we do want to focus on looking at your range of motion. If you have full knee extension, that's awesome. If you're getting close to 90 degrees of flexion, that's awesome. But typically when you're going to spend time sitting, whether you're eating a meal, whether you're resting and recovering, we try to encourage our patients not to sit for durations longer than 2 hours. If you're drinking enough, if you're hydrating yourself enough, you're going to have to get up and go to the bathroom in less than 2 hours anyway. But the idea is when you are sitting, either have the leg elevated if possible. Elevated above the level of the heart is ideal for drainage, but at least elevated off the ground, supported, is going to be a great way to minimize excessive fluid accumulation into the foot, the ankle, and the lower leg. If you do have the foot down in a dependent position, try to be in a chair that allows you to rest the foot comfortably on the floor so that you're not suspending the leg in midair. If you're limited in range of motion or really challenged with gaining knee flexion, you do want to consider being in a chair that has an adjustable leg rest or placing cushions under your leg so that you can take some of the tension of gravity off if you're not at 90 degrees of knee flexion yet. And if you're sitting with your leg extended, understand that there's a difference between when you're working on improving range of motion, you want to have support under the ankle and the heel, no support under the back of the knee. But when you're sitting with the leg elevated for rest and recovery, you don't have to stress the back of the knee. You can place some support, you can place some contact, whether it be a cushion or a pillow or whatever you have, under the full length of the leg so that it's not miserable throughout the entire sitting experience. We don't need you working 24 hours a day, 7 days a week. Like, the body improves when you recover, and you need time to recover. There's a work time and there's a recovery time. So overall, best sitting positions during the first 48 hours, any position that feels comfortable to you. From day 3 to day 14, have some support, understand if you're trying to gain range of motion or if you're just resting in recovery. And then of course, once we get past day 14, if we're looking at weeks 3, 4, all the way to week 6, you can pretty much sit in any position you want. As long as you're continuing to work on gaining range of motion. We try to advise against sitting for really, really long periods of time. Like if you have to sit at a desk to do some computer work, try to arrange that time so that you have to get up every 2 to 3 hours, go to the copier, go to the bathroom, go get yourself something. But sitting for longer than 2 hours really will increase the challenges with swelling, will increase the challenges with stiffness. You probably already know by now, a little bit of movement is going to be your best friend. If you have any other questions, let me know. Otherwise, I'll catch you on the next video.